Welcome, everyone. Good evening. My name is Anmol Gupta. I am a medicine pediatrics resident physician and a Capello Fellow at Doctors for America this year. I'm very excited to welcome you all to our December Advocacy Ground Rounds event, the last one for this calendar year. Before we get started, I wanted to take a quick minute to invite you to officially join Doctors for America if you are not a member yet, and the DFA fight to improve healthcare for all. We are a movement of over 40,000 doctors and medical students across the country who have come together since 2009 to ensure that everyone has access to equitable, affordable, high quality healthcare and the opportunity to lead a healthy life. Becoming a DFA member is easy. Just go to the link in the chat that someone from the team will drop shortly to support DFA's work to improve healthcare with incredible programs like this Advocacy Ground Round series tonight. Today, we will be live streaming this presentation to Facebook Live, as well as recording it, and all materials will be made available afterwards. A few quick ground rules for tonight. We welcome all of your questions. Please use the Q&A feature on Zoom to send us your questions. We will address these during the second half of our session. And look out for comments in the chat. We have several fantastic DFA staff members who will be sharing helpful links throughout the conversation tonight. Now, on to our speaker. We are thrilled to welcome Dr. Adrian Fu Berman. Dr. Fu Berman is a professor in the departments of pharmacology and physiology, as well as the Department of Family Medicine at Georgetown University Medical Center. She teaches evidence-based medicine and leads Farmed Out, an educational project at Georgetown that promotes rational prescribing and exposes how pharmaceutical marketing shapes clinical practice. Dr. Fu Berman is a nationally recognized expert on the physician-industry relationship. She has published extensively on marketing tactics such as ghostwriting, off-label promotion, use of key opinion leaders, and other strategies that influence prescribing. Her widely cited presentation, Why Lunch Matters, was the first to show that clinicians can underestimate their own vulnerability to industry marketing. She lectures internationally and has appeared on major television networks. Previously, she served in the Contraception and Reproductive Health branch at the National Institute for Child Health and Human Development within the National Institutes of Health. Dr. Fu Berman graduated from Georgetown University School of Medicine and completed a family medicine internship in the residency program in social medicine at Montefiore Hospital in the Bronx. I will hand it over to Dr. Fu Berman for her presentation tonight.
Thank you so much. I'm really thrilled to be here and speaking for Doctors for America, and I do encourage anyone who isn't a member to become a member. And my conflict of interest disclosure is that I'm a paid expert witness at the request of plaintiffs in litigation regarding pharmaceutical and medical device marketing practices, mainly on behalf of state, local, and federal government. So I'm going to talk today about the FDA, a little bit about the history, a little bit about what's wrong with the FDA today. But just a little bit about the history first. So there, before the FDA, there was a division of chemistry, later the Bureau of Chemistry, and there was an amazing crusading chemist called Harvey Wiley, who was really important in establishing the original FDA and in working on particularly on food adulterants. But before the FDA was started and after as well, the AMA actually used to assess drugs. So in 1905, they had this Council on Pharmacy and Chemistry, and it actually kept going until 1955. And they wouldn't let manufacturers advertise their drugs in JAMA unless they had the AMA's seal of acceptance. And they actually put together so they had sort of panels of people who are clinicians and scientists who evaluated drug claims, and they also even criticized they criticized manufacturers for over promoting their drugs. And this was a really interesting time in the AMA where they actually were very activist on behalf of patients and in terms of actually evaluating drugs. So the Food and Drug Administration currently regulates drugs, biologics, medical devices, also veterinary drugs, food, and most recently tobacco. That's been the most recent thing that has also radiologic devices as well. So CDER is the Center for Drug Evaluation in Research that evaluates drugs. CBER evaluates biologics. And they also monitor adverse event reporting through the FDA adverse event reporting system called FAERS. And then in coalition with the CDC, they also evaluate adverse effects of vaccines through VAERS, the Vaccine Adverse Event Reporting System. What they don't do, they do not regulate the practice of medicine, and they don't take cost into consideration when they're approving drugs. They don't take into consideration what other drugs are available. They don't compare drugs when they're approving drugs. It's some of the things that they don't do. So there are three most important dates in terms of FDA of acts that are important to the FDA: 1906, 1938, and 1962. So 1906 is what really the Pure Food and Drugs Act really established what's the modern FDA today. And that act was really about labeling and adulteration. So this is a picture of Harvey Wiley, the crusade called the crusading chemist, and I think he came up with the term like adulterants in terms of what was put into food, because at the time bread was sometimes adulterated with wood pulp. Milk was sometimes adulterated with chalk and water. These are the pictures of several products that were really misleadingly labeled. So salad bouquet was vinegar, but it was a very dilute vinegar. Peanut spread had very few peanuts in it. It was mainly another kind of fat, maybe lard. And bread spread looked like strawberry preserves. It even had seeds in it, but it was really pectin, red food coloring, sugar, and some hay seeds to make it look like there were strawberries in it. So there were many foods that were mislabeled, and drugs as well. So, for example, there was a soothing syrup for colicky children that probably worked really well because it had morphine in it. And these foods and drugs didn't have to be labeled with what was actually in them. So the 1906 Act prohibited interstate commerce in adulterated or misbranded food and drugs. And again, Harvey Wiley was most important for this. So as I said, the current Food and Drug Administration doesn't regulate practice of medicine. It also doesn't test drugs. So it's relying on manufacturers to provide data on drugs. So I just love this concept of the poison squad that Harvey Wiley had created. So on a budget of $5,000, he actually got a group of volunteers. Every time I tell this story, someone bursts out, "I would never volunteer for this." But there were many preservatives and adulterants in food that there was no actual information on. And so these volunteers actually ate um, um, preservatives and other things that were used in food in increasing amounts to see what effects they had on the human body. So they ate together in this dining room, and they were fed increasing amounts of substances that were put into food. So hence the sign, "None but the brave can eat the fair." This is some of the first information that we had about some of the substances that were being used in food. So Wiley was a very creative person. Um, so there have been several tragedies that have resulted in regulation, in laws having to do with the FDA. And it's sort of interesting to think about because I'm not sure if we had these kinds of tragedies today that they would actually result in the level of outrage and change that they used to. But in 1937, there was an antibiotic, sulfanilamide. It's an effective antibiotic that was being used in adults, and the Massengill company created a version for children that had a nice, lovely raspberry flavor, and it had been tested for flavor and a very acceptable flavor. It was kind of hard to dissolve, and the chemist who was creating the formulation that would work had to use different solvents to dissolve it, and he settled on diethylene glycol, um, which is antifreeze. Antifreeze is sweet. That's why it sometimes poisoned dogs who have you know how they love to drink out of the toilet, and if the toilet has antifreeze in it because someone's trying to keep the pipes from freezing, that will kill a dog. And elixir sulfanilamide killed humans. It killed over 100 people, about 106 people, many of them children, because this was the children's flavored version of the antibiotic. And it was really an incredible story of how FDA inspectors when they found out when the FDA found out that this drug was killing people, they fanned out almost every inspector and chemist who worked for the FDA across the country trying to get back every bottle of elixir sulfanilamide that had been prescribed. They went through shipping records of the company. They tried to get in touch with every salesperson who had been distributing the drug. They tried to get in touch with healthcare providers. They really, it was this incredible campaign to try and get every single bottle of sulfanilamide, not just off the market, but out of people's homes. Who actually went to people's homes and tried to recover every single bottle. So that was amazing. Now, at the time, so this was before the Act of 1938 was passed, that it was not illegal to sell the drug because it was toxic. The way that they were able to go after the drug was mislabeling. So remember, 1906 ad was about mislabeling. It was mislabeled because it was called an elixir, and elixir had to have alcohol in it, and this did not have alcohol. It had diethylene glycol in it. So that's how they were able to go after this drug. So, but the tragedy, all these children dying, did result in passage of the 1938 law, which required that drugs be tested for safety before going on the market. And then the next tragedy that resulted in and so in good drug regulation was because of the thalidomide disaster that happened in the really the 1950s and early 1960s. Now, thalidomide was a drug, a sedative drug that was widely it was approved and widely used in other countries. And it was not approved in the United States, mainly because of the efforts of a pretty green FDA medical officer, Francis Kelsey, who had been given this drug to assess for approval because, well, it's already been approved in Europe. This is a really easy open and shut case of approval. And she was really concerned about some of the results that she had seen and refused to approve this drug. So thalidomide was never approved in the United States. However, there were actually at least 17 thalidomide babies born in the US. So thalidomide, it's at certain points in pregnancy will, if given certain points in pregnancy, will result in these foreshortened or absent limbs and heart defects and other problems. A lot of babies who were exposed to thalidomide died, which is one reason why we don't know how many thalidomide babies were born in the US. But the reason that there were these thalidomide babies that were born in the US is because at the time, drug companies were allowed to send out free samples of drugs to physicians before that drug was approved. So there were thousands of samples of thalidomide that were distributed to physicians in the US before the drug was approved, and they were given to pregnant women. And we know that there were at least 17 babies that were born. There may have been others who died that we don't know about. So thalidomide did result in the 1962 um, Kefauver-Harris amendments. And this was the first time now in the US that drugs had to be proven effective before they were sold. So 1938 was safety, 1962 was efficacy. And the Kefauver-Harris amendments also required other things. So they required that there be adequate, well-controlled clinical trials done. Um, FDA approval, you had to get the drug FDA approved before it could be marketed. Manufacturers had to report serious adverse effects that they knew about. And so not only from clinical trials, but also if anyone writes or informs a drug company about an adverse effect, they are obligated by law to tell the FDA about that serious adverse effects. So serious adverse effects um, serious adverse effects, including deaths, disability, birth defects, anything requiring hospitalization, or anything that requires medical intervention that prevents one of the above. So anything that either requires initial hospitalization or keeps somebody in the hospital or requires medical intervention. Anyway, so any serious adverse effect has to be reported by a drug manufacturer to the FDA. And then the FDA also sets good manufacturing practices and they control prescription drug advertising. But there have been a lot of problems with the FDA over the last 30 years, and these have all been compounded under the current administration. We're really just in the Wild West at the moment. But even before the Trump administration, there have been a lot of regulatory failures that have affected the FDA, and probably one of the worst things that's happened with the FDA is the Prescription Drug User Fee Act, which requires manufacturers to contribute money to the FDA for drug approvals. And the idea was that this would result in drugs being approved faster, but it's also created a lot of problems. Everything's much worse now. But really, relying on funding from the industry, we're the wealthiest country in the world, and we should not be relying on funding from the industry for actions that are regulating that same industry. So Farmed Out has a report available on our website, or if you want a hard copy, you can write us. That we think is a great report, and it addresses four themes about what needs to change at the FDA: transparency and accountability, innovation, pre and post market standards of evidence, and value in healthcare. And well, I think this is a really great report. It came out I think about a year and a half ago. It also, at this point, seems kind of quaint because the FDA has been so wrecked under this administration. So this is what the Trump administration, says that they're going to do, and a couple of these things they have actually published. Um, they have published some rejection letters. They have objected to some advertising from pharmaceutical companies, but really most of what they have done has been really quite harmful. And some things have just been sort of disingenuous. So while they say that they have released 200 complete response letters. These are letters that are written to drug companies regarding decisions made about their drugs. Um, in fact, most of these were already publicly available. So there were only 23 of these. Well, most of these were for drugs that were already approved. So the response letters were already publicly available. There were really only 23 of these 200 that were not publicly available. So sometimes they're taking credit for things that they haven't really done. But what's far worse, and there are a variety of things happening under this administration that are really awful. But this is one of the things that is causing a lot of harm. So the FDA used to have, still has a few these advisory committee meetings, and these are meetings that of carefully vetted experts from the variety of expertise who've been vetted for conflicts of interest, who are highly qualified, and they and would have these meetings that would last a day or 2 days. The FDA didn't have to have an advisory committee meeting for every drug or every biologic, but would use them if there was if there was a lot of controversy about a particular drug, or if they just wanted outside help in assessing a particular therapeutic. They would convene these advisory committee meetings. There would be open public hearings where anyone could testify about about the therapy under consideration. And the FDA almost always, not always, but mainly took the advice of its advisory committee meetings, which were open public meetings that anybody could attend. So what the current head of the FDA has put into place, Marty Makary, is these expert panels that are not expert panels at all. They are groups of pre-selected people who seem to be selected because they reflect the opinions that Makari already has. Anyway, and they've had these expert panels now on menopausal hormone therapy, on testosterone, on SSRIs in pregnancy, on talc. So there's been a number of these panels that are put together with that often contain unqualified people and have come to really outrageous that meet for a couple of hours. They have no real discussion and have made really outrageous claims and statements that are then being used to justify these decisions that the that that McCary wants to make. So so some of the things that they've done is to remove the black box warning on menopausal hormone therapy that warns that hormone therapy can cause breast cancer and increases the risk of dementia and shouldn't be used for preventing cardiovascular disease. It's just been really terrible. So this is just a way of circumventing the usual process by which the FDA works. They've shunted aside the actual experts at the FDA. Decisions are being made by a few people who are not necessarily qualified to make those decisions. So advisory committees, well-vetted experts, and these current expert panels include influencers, people who are just clinicians, entrepreneurs. One of them actually had a pharmaceutical company representative on it, and they're pre-selected to reflect his views. And they have a pretty consistent record at this point of coming to really wrong, non-evidence-based conclusions. So the panel on SSRIs in pregnancy said that they cause autism, miscarriages, birth defects, which they don't. The one on menopausal hormone therapy said that hormone therapy does not cause breast cancer, which is not true. Combined hormone therapy does cause breast cancer, and it's an effect that actually gets stronger over a 20-year follow-up period. The panel claimed that menopausal hormone therapy would prevent dementia when randomized controlled trials show that combined therapy increases the risk of dementia in women over 65, and estrogen alone increases mild cognitive impairment. And a recent panel on testosterone claimed that testosterone that all men should be tested for testosterone, and that this was a marker, it was an important marker for men's health, that it would prevent diabetes and osteoporosis, even though randomized controlled trials that have tested this question have found that it does not prevent diabetes, it does not improve blood sugar in diabetics, and while it does increase bone density, it also increases fractures. Cindy Pearson, former director of the National Women's Health Network, actually disrupted this expert panel meeting to ask McCary whether he would have a an advisory committee meeting on hormone therapy, and McCary's on the record of saying, "Oh, well, these advisory committees, they take too long. They're bureaucratic. They're expensive." So he wants to substitute these ridiculous expert panels that are not really expert panels. The FDA is in chaos. People are leaving right and left. You really can't trust information that's coming out of the FDA at this point. So here are some of the things that were said at the menopausal hormone therapy expert panel. Menopause shortens women's lives. Interesting thing to say when you consider that women live longer than men. So you could just as easily say that the lack of menopause is a problem in men. McCary said HRT. So, and we no longer use this term. HRT stands for hormone replacement therapy. It's an inaccurate term. We use the term menopausal hormone therapy, but he's gone back to HRT. Saved marriages, rescued women from depression, prevented children from going without a mother. Completely ridiculous statement, and very reminiscent of Robert Wilson, Feminine Forever, 1960s, like these ridiculous claims that were made back then. And they're actually taking off this black box warning and threatening taking off a black box warning. Telling women that menopausal hormone therapy increases breast cancer and dementia risk. And McCary also said that they wanted to add the benefits of hormone therapy onto the label. They had an expert panel, so-called on antidepressants in pregnant women that claimed that SSRIs caused a lot of problems, and medical societies stated they were really alarmed by this very unbalanced group and unsubstantiated claims. These panels, by the way, are pretty characterized by the fact that, oh, everybody seems to agree. They make these little 5-minute presentations. Everybody agrees. They're 2 hours long, and that's that. The testosterone expert panel, people said it's a cornerstone of preventive health. It's a biomarker of early death. It's a disease amplifier. No mention of the risks of blood clots, fractures, atrial fibrillation, non-fatal heart arrhythmias, kidney injury, increased blood pressure, increased PSA. Another outrage are these national priority voucher programs, which are these like ultra fast drug reviews for drugs that supposedly fit the priorities of this administration. To apply for these, companies have to fill out a 350 word a form that requires 350-word justification on why their drug should receive a priority voucher. And this is really politicizing what drugs and what drugs get approved, and is really an outrage. So I just wanted to give like at least one case study about some of the things that have been wrong with the FDA, not just under the administration, but this extends into this administration. So I wanted to talk about Addy, or flibanserin. So this is a drug that is used to treat low libido in women. Low libido is not actually a medical condition, but it's kind of the daughter of female sexual dysfunction, which was also something that was invented by pharmaceutical companies. So both female sexual dysfunction and hypoactive sexual desire disorder were terms that were created by industry, and that's been well documented in this book by Ray Moynihan and Barbara Mincies. And you gotta love the definition of hypoactive sexual desire disorder: persistently or recurrently deficient or absent sexual fantasies and desire for sexual activity that causes marked distress or interpersonal difficulty. Um, Note the interpersonal difficulty. So even if a woman is happy with her sex life, if her partner is unhappy, she can be diagnosed. And of course, there's no scientifically established norm for what's a normal level of libido. Decreased interest in sex can be caused by a lot of things. children, for example. And in cases where there actually is no medication or relationship problem or anything else that's causing a problem, psychological treatments have been shown to be effective. But the marketing messages to sell hypoactive sexual desire disorder were that this was like a very common, this is often a marketing message for a pharma invented disease. The disease is common, it's underdiagnosed, it's ruining people's lives. You, the physician, can diagnose this, you can make someone's life better. In this case, women may not even be aware that they're sick. Simple questionnaires can aid diagnoses. They created something called the Female Sexual Function Index. This was, and it didn't have a scoring system, so you could fail anybody, but really anybody would fail this test anyway. So this is my favorite question from the Female Sexual Function Index. Over the past 4 weeks, how often did you feel sexual desire or interest? And if you said that if the patient said that she felt sexual desire or interest for 50% of her waking hours, she would only score a 3 out of 5. In order to get 5 out of 5 on this question, you had to say that you felt sexual desire or interest all or almost all of the time. So these tests are meant for people to fail. And we've written about HSDD and how continuing medical education, particularly pharma-funded continuing medical education, was used to establish this as a diagnosis. This drug, flibanserin, is a sedative drug. It's actually a failed antidepressant, and it doesn't work well. It increased sexually satisfying events, which need not include either an orgasm of a part or a partner, by zero point 0.8 events per month. In general, for women over 65, it was 0 0.3 events a month. And a dose of Addy is as sedating as 4 alcoholic drinks. It can cause fainting, sudden 40-point drops in blood pressure, and it interacts with a lot of drugs. And commonly used drugs, things for migraine, oral contraceptives, fluconazole, digoxin, it interacts with a lot of drugs. So the FDA approved flibanserin for premenopausal women in 2015. Flibanserin was really approved because of this major public relations campaign that the company that was promoting this drug created, where they accused the FDA of sexism. They said there were 26 sex drugs for men and 0 for women. That wasn't true, by the way. There's never been a drug approved for increasing libido in men. But they created this really incredibly creative and effective PR campaign that convinced an advisory committee in the FDA itself that Addy should be approved. And right after it was approved, the company that had it sold it within days to a Canadian pharmaceutical company for $1 billion. And even though they had created this narrative that there were millions of women that were clamoring for this drug, the drug sold very poorly. Women were too smart to use this drug. And Sprout shareholders ended up suing Valeant for not promoting the drug well enough. The company gave the drug back to Sprout, and then Sprout sold it through telehealth. Um, but this drug is going to come back because under just last week, um, the FDA approved the drug, approved Addy for postmenopausal women who are under 65 years old. There weren't women over 65 in the clinical trials. So even though this drug didn't work well in anybody, it worked even less well in postmenopausal women. Any effect it has are probably due to sedation. Certainly getting better night's sleep might actually improve your sex life. But we're going to be apt to see a lot more adverse effects in older women who are taking this drug, in postmenopausal women who are taking this drug. So I hope they don't take it. This is really expanding use of a problematic, ineffective drug that was approved for a condition that was invented by pharmaceutical companies. So my message is we should not be trusting information coming out of the FDA at this point. Unfortunately, the current FDA is actually spewing misinformation. And it's really important to use independent sources of information. We have a list of these on the Farmed Out website, but things like medical letter, Prescrire, which is a French drug therapeutics letter, but newsletter, but it's available in English and is actually really excellent and really easy to read. I highly recommend it. But we need to use independent sources of information. And we also may need to be using medical societies and other ways of assessing drugs because we really can't trust the current FDA. So I hate to say that it has this really vaunted and important and noble history, but at this point in time, under the current administration, it really can't be trusted. So we have more information on a variety of topics and and we're doing a lot of work currently on menopause and low T, low testosterone, weight loss drugs, dementia drugs, a lot of different things. So I hope you'll subscribe to our newsletter, look at the resources on our website, and I'm happy to take any questions.
Well, thank you, Dr. Drew Berman. That was fantastic. I think I really appreciated the little bit of history, and you really painted a picture of where the FDA started, where we are now, and sort of how we're maybe going back to a pre-1962 FDA, which is concerning. So we will be entering the Q&A section now. So I encourage everyone who's listening to put in some questions that you have in the Q&A section. While people are doing that, maybe I'll start with our first question. As I'm sure many of the folks listening tonight, medical students, physicians, they're having conversations with their patients every day about medications, treatment options, and why they're the right ones for those patients. I'm curious, as a physician yourself, how do you think we should be explaining FDA decisions to our patients when those decisions are being informed by these expert panels as opposed to these advisory committees?
Oh, wow. Yeah. I mean, I think the brilliant thing about these fake expert panels is that most of the world doesn't know about FDA advisory committees or their importance or how the FDA works at all. So they don't know that this process has been completely corrupted at this point, right? Like they don't know the difference between an expert panel and an advisory committee or whatever. So it is difficult to explain. But I think. I mean, we should, in general, we should focus on prescribing older drugs, drugs that have been tested, generic drugs. So I can, unless it's for a condition for which there's like no other drug treatment. In general, we should avoid newer drugs until there's more information on it. It takes years to really, establish adverse effects. And with the pace of things being approved at this point, it's really just going to be a nightmare for going forward. Yeah, how do we explain these things? Yeah, I mean, I think it has to do with like explaining to patients that we want to practice according to evidence when evidence is available, and that just because a drug is approved by the FDA does not mean that it's necessarily a safe or effective drug. And yeah, I mean, those can be difficult. Difficult conversations to have, but just relying on an evidence base is really important. I mean, I know that this group has skepticism and will assess things in an objective way, but a lot of doctors are being convinced about menopausal hormone therapy and testosterone, and that that these things are good too, and that's we have to fight misinformation wherever it is.
I think so much in medical education, we don't even really learn about how the FDA works in these pathways. I know I don't think I would know about this issue if I wasn't here with DFA. So,
Right.
um, yeah. So we do have a question from Dr. Janet Cromes, who is the chair of our FDA task force. She says, "Thank you for such a wide-ranging talk. What are your thoughts on whether and how the regulatory framework should change? Are there specific pathways you find exceptionally problematic?"
Yeah, yeah, great question. Like, there's so right now I'd be happy for things to go back to the way they were a couple of years ago before this administration took over, even though we had a lot of complaints about that as well. But the way that the FDA has accepted has accepted promotional language in terms of its accelerated approval pathways. Um, we're not assessing drugs in the same way that we used to. We're approving drugs too fast. We're accepting levels of evidence that weren't acceptable previously, adaptive design trials, and that sort of thing. I think we have to go back to or some earlier times in order to be assessing drugs more thoroughly. But even before this administration, the FDA was s- would sort of applaud drug approvals and not sort of convey to the public that rejecting drugs was just as important as approving drugs, or maybe even more important, and that sort of teaching the public about like what goes into approving or rejecting a drug, and why the FDA is doing that. So anyway, there's a lot a lot of different things that around the pharmaceutical company promotion that I think should be regulated, like continuing medical education should that's industry funded should be considered promotion and should be regulated, and there's a lot of other things as well. But anyway, we have a lot of suggestions in our FDA report, so I hope people will look at that.
So we got some great questions coming in. Jonathan Raymond asks, did not catch the panel on SSRIs and pregnancy. Are there any valid concerns about their use that they posited?
Um, so so they were claiming that SSRIs are causing miscarriage, autism, birth defects, and some other things. There's not evidence for that. But one of the other there are some problems with SSRIs for sure. But there also are problems with not treating depression in pregnancy. That's also really a concern as well. But these panels are made up of people who are very biased, sometimes not well qualified, and they're not set up to actually have any real discussion. They don't discuss data. It's just people giving these opinionated 5 minute the 5 minute talks. They don't they usually don't present data. They're certainly not discussing data. They're not really discussing any questions. And most of them aren't really qualified to do so anyway. So there are some questions that are certainly worth discussing, but they need to be discussed with qualified people in circumstances um, that foster careful consideration of the question and that involve public participation.
So, on your last slide, you sort of talked about alternative places that we can be going for reliable information. Eric is asking, given the dismantling that we're seeing at the CDC and FDA, do we need to be creating alternative agencies for the medical community and public, like what the American Academy of Pediatrics is doing with vaccines? Any thoughts on that?
Yes, I think we do at this point. Like we need to be establishing our alternative ways of assessing these things. I think what the AAP is doing is good, and they've just had some federal grants yanked. So that's how political this administration is. And yeah, so they've just yanked a bunch of grants to the AAP as as punishment for their standing up for rational vaccine recommendations. So Yeah, but I think we need to be doing we need to be doing our own assessments and relying on unbiased sources as much as possible. It's also really important with continuing medical education. We're the only group in the world working on industry influence on continuing medical education. All and industry funded CME is always marketing. And the marketing messages can be very subtle and very hard to see. So please rely on non-industry funded CME, like CME required by Doctors for America, but that's put out by Doctors for America, and other places. So yeah, Eric, I agree.
Um, Keisha Davis is asking, um, are there more recalls than usual, or is it just that they are publicized? I know that in the past few months we've seen a lot more media coverage of recalls. One that comes to mind is formula. I'm curious if you can answer that question, but also speak to sort of because the FDA plays a role in our food safety, formula safety, how this whole issue is impacting that realm as well.
Yeah, I don't know. I don't know if there are more recalls than usual. That's interesting. And yeah, and I just don't know enough about food regulation to talk about that.
No worries. I know one thing that your group Farmed Out also works on is direct-to-consumer advertising, which I know we didn't speak too much about today, but Janet Crumbs is asking, do you see any potential for progress with the FDA's approach to direct-to-consumer advertising? Has there been any meaningful progress there?
So yeah, the U.S. and New Zealand are the only countries that allow direct to consumer advertising for drugs, and that is an important part of influence. But but we sort of monitor some of the things that pharmaceutical companies talk about, and it doesn't hurt them as so much in countries that don't allow direct to consumer advertising because every country allows disease awareness campaigns and disease if a pharmaceutical company has created a disease or expanded the definition of a disease, they can sell the drug by promoting the disease. So disease awareness campaigns are allowed in every country. And there's also just a lot of different marketing methods that are used. So not to diminish the importance of direct to consumer advertising or direct to consumer promotion, because of course there's all kinds of promotion that are not straight advertising. Um, this administration they have actually sent out quite a few letters to pharmaceutical companies about 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 their advertising, trying in efforts maybe to make that advertising less inaccurate. I don't personally think that's going to have that much effect on things, but at the same time that they're saying like, oh, we're going to, sort of rein in pharma's influence on these things, they're they are relaxing all these standards on approving drugs. So they're actually they're really helping pharmaceutical companies a lot while sort of making a show of, oh, but we're going to rein them in on direct to consumer advertising. So I think it's a little bit of it's a little bit of a red herring sort of to say that uh, we're we're reining in pharmaceutical companies when really they're giving away the shop to pharmaceutical companies.
We have a few more minutes left, so I'd encourage folks if you have questions, put them in the Q&A. While people are thinking of their last few questions, this might be a little of a big one, but I'm curious, we're seeing that it's so easy to break our institutions, and there's going to probably be a lot more work and time to repair it. Um, if and when we do have a new administration, I'm curious what your thoughts are on what would be the first steps to repair the FDA, and rebuild trust among physicians and patients. Do you have any ideas on what that would look like?
Yeah, I mean, the first thing would be, getting rid of every person that Trump has put in there, or that this administration has put in there, and begging the scientists to come back and and there are definitely things that needed to be improved at the FDA before this administration, and I think we've made a lot of suggestions, and we've made a lot of suggestions in our report. But what yeah, the first thing yeah would be getting rid of the people who don't care about evidence. Like, these decisions should not be made on personal opinions. And there are people in the administration that seem to think that, just like, well, we're smart and we'll just make the decisions, and not going by any processes, not consulting people who are really expert, not convening advisory committees, or even using people who are scientific reviewers and scientists within the administration. It's just been a complete disaster. But it's, as you implied, it's really difficult. It's going to be really difficult building something up after it's been so corrupted. But it will also be an opportunity to make it better. So I think it's really important for people to be politically involved in helping to create a better system. And I think DFA is, really great at helping people to become politically involved, but and also just to not to go beyond clinical practice, right? To make things better for public health and not just individual patients. That these non-medical and political factors that affect public health also affect the individuals who are our patients, and they affect the knowledge that we have, and how we choose to treat them. So it's really important on every level.
And I think to sort of piggyback on that, Eric is asking, how do we get the public behind correcting these problems before the system crumbles? And there's so much going on in our day-to-day news and institutions. How do we get the public to care about this issue? Because this is a little bit more of a technical one.
Yeah, and I mean, people do care about their health, and we have to work on getting them to care about evidence, as and when and what the connection is to health. Yeah, how do we do that? Um, I don't know. It's something we'll all have to think about.
Well, that's what I think we can all think about into the new year. And hopefully DFA is a community that people feel like they can have these conversations about. So um, I want to thank you for this session, Dr. Fuberman. This was really fantastic, a really thought-provoking discussion. We are really grateful that you took time to join us this evening.
Thank you
Um,
so much.
of course, for everyone joining us, thank you for being here and everything you do on behalf of your patients. We hope that if you're not an official DFA member, that today we've convinced you to join. The number one reason that doctors, med students, health advocates join DFA is to be with like-minded people and to share the same values and priorities, and to have conversations like this with Dr. Fuberman. Please watch for additional opportunities to engage with DFA, including our National Leadership Conference that's going to be happening on June 6th to 9th in Washington, D.C. It's really special. This conference only happens once every 2 years, so this is the year to come. I think one of Sophia is going to drop a registration link in the chat. And for those of you that are sustaining members of DFA, reminder to complete the survey in the chat for your 1 credit of CME for attending this session. If you enjoyed this session as much as I did, please consider supporting DFA's work and impact with a financial gift. The link to donate will also be put in the chat and is also available on our website. Of course, you can follow us on all the social media platforms, Twitter, LinkedIn, Instagram, Blue Sky, and Facebook to stay up to date with all of DFA program events and ways to get engaged. Thank you so much. Dr. Fuberman, I don't know if you have any last thoughts or anything you want to leave our audience with before we call it tonight.
No, thank you so much. Thank you so much for your interest. Thanks for the invitation and stay strong, everyone.